Welcome to another episode of Healthcare Hygienists with Heart. My name is Jamie Dooley, and I am the Executive Director and founder of the National Network of Healthcare Hygienists. Today, I have with me Dr. Megan Reutter, who is our Curriculum Director for our brand new Oncology Certificate Program. And I invited Megan to sit with me today and do a little interview because I think it's really important for all of us to share why oncology is so important to us. And I also want to mention that her and I have been working on this certificate program for 18 months. This didn't just whip together overnight. You might just now be hearing about it, but this has been a labor of love for her and I. And we have worked tirelessly. We're texting each other at 11 o'clock at night. So I just wanted her to share why she's so passionate about oncology, both as a dental hygienist, as a healthcare hygienist, and as a person. So thank you, Megan, for being here with me today.
Thank you, Jamie, for having me. And just as always, we have so much fun hanging out together and working together too. But I think this is just kind of a nice way to, as you said, share your why. And I think that's so important for us as we are going through anything, whether it's the oncology curriculum or any goal. Keeping in mind and connected to that why is so important. And so for my why of why I wanted to do this curriculum director for the oncology certificate, mostly from a personal side. I had a sister-in-law that was diagnosed with breast cancer, and they actually found it while she was pregnant with her second child. And so she had
How old was she, Megan?
she was about 31, 32. And unfortunately, she passed after about 2 or 3 years. I think she was 3 years after, no, 2 years after she was first diagnosed. Then the cancer just spread everywhere. It started, like I said, in her breast. It was triple negative, and it was just a really invasive type of cancer and very advanced and progressive. And so every time she'd go in for a scan, it would spread to her liver, it would spread to her lungs, it would spread to her ovaries, it spread to her brain. It pretty much just took over every single time they did a scan for her. And so as we were going through, sorry, that's my clock, and I have my grandma's clock. She's saying hello.
I love it.
And so as we were going through and, helping with the kids, with the girls, and then
I can't even imagine.
So the girls Kate was 3 and Anna's is 1. They're about 18 months apart. And so we would help out with the girls a lot as they would travel. They went all over to try and find treatments for her. And so one of the hardest things for me as having that hygiene background and knowledge was trying to help her manage some of her oral symptoms. And her mom had her on a very, strict nutrition diet and regimen, and they did everything, as
By the book.
by the book, and
Yeah.
even holistically, kind of the trying alternative options and, kind of supplementing with the primary Midwestern healthcare. And so one of the things that I really was struggling with was she's had trismus because as she was going through radiation for her brain, she had the radiation mask put on and made for her, which Jennifer Brown will supplement in the video, so we'll be able to see that of how that is made. But she would explain how as she would get the radiation, her jaw, she'd have to sit so incredibly still, and her jaw would be held so tight during that time. And she never had braces. So, and her teeth weren't really crooked, but just, I think the slightest offset was really
her occlusion. Yeah.
And her bite was not right. And as us hygienists, we know that can make such a difference. And so, she would say, my teeth just hurt so bad, and my jaw and into my ear. And it was just one of those things. And my sister-in-law, ironically, on the other side, is a hygienist too. And so when we would kind of get together and talk, we would just kind of look at each other like, I don't know what to do. And so I think that was where just seeing her struggle with everything, quality of life, was really hard to watch. And so with that, and then as we see patients who come into our chair side and you just see their teeth crumble and deteriorate. And I do a lot of community health fairs, and I had a lady that was probably in her 50s and had unfortunately all of her teeth were extracted, and she was telling me how she went through chemo and several times, and she goes, I never knew how to take care of my mouth, no one told me. And she goes, that's why I lost all of my teeth, because she was then looking for a referral or a dentist in the area of who can basically help give me dentures. And so
Yeah.
it's
So
kind of
you've
great.
just survived cancer, and now
And now what are you left with?
no one's talked about how to better care for your oral cavity during this really important time. And now you've got to deal with the loss of teeth. On top of that, I can't even imagine what your sister-in-law was going through. Um, and you're right. I mean, if she presented in my chair when I was clinical, I wouldn't have known how to help her either. So the oncology world is expecting they're just going to go to their dentist and we're going to take care of this. And the dental world is going, we don't really know what to do either. And so what we did was put together a group of hygienists who had already specialized in, and we have ancillary providers. So we have some medical providers as well, so that we can really enrich this certificate program that we put together. We did it for this reason. What other oral manifestations did your sister have? Was it just the trismus?
The trismus, and I do know that some of her teeth were getting weaker because she did have some fluoride trays that were made during that time for her too.
Because the xerostomia is so bad.
Yes, yes. And, I think as when we'd have these conversations, I've been a hygienist. I'm very passionate about hygiene, and I love to learn, and I teach oral path and dental hygiene. And I still felt like, why do I not know what exactly to do here?
Yeah.
And so I just felt like I was still missing something. And, as we start putting these modules and things together and start learning, it just like opens up this whole new world of things to just keep diving down into and learning about and figuring out, because there's just so much to it.
Yeah, and we live in a beautiful time where, we have so much information at our fingertips, but it can be, if you have a patient in your chair or you have a loved one going through this, you don't have the time to try to find, weed through everything on the internet and put together what actually is going to matter. And so we've done that work for you. We've taken and gone to the leading experts, people like Susan Cotton, who has created the best practice doesn't even, right? It's above standard of care, but Susan took best practice and blew it out of the water. She is going to teach you her Cotton method, the 4 pillars of screening, so that you are going to be able to catch any precancerous lesions early and literally save more lives. You're already saving lives from an oral systemic standpoint. You're going to be able to save so many more lives just with Susan's module, and she's only one of our amazing instructors.
Yeah. 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 And, I think with the interview with Liz, she's taught pharmacology for 20 years. She was my pharmacology instructor. She's been through breast cancer herself. We've got Jennifer Brown. She's actually a hygienist that is working in oncology as well. So we've got a nutritionist that specialized in oncology for 2 years. So we just have such a wonderful background of different hygienists, different levels, different providers, that it's just going to be a really nice, balanced, well-rounded curriculum.
Yeah. And that's why we wanted to bring this to you. Like Megan said, she's teaching hygiene. And so there's a knowledge gap. We just don't have time in hygiene school to learn all this specialized knowledge. And then on top of that, because technology is so prevalent in the oncology treatment world, to try to stay up on that, you don't have the time, and hygiene schools don't have the time to work that into the curriculum. So that's where the network comes in. We really want to be that bridge, that gap of knowledge for hygienists that want to specialize in an area or just have specialty knowledge in an area to better care for the patient in their chair. So whether you want to work in an oncology setting, and we've spoken to, hey, Megan, offhand, I can think of at least 10 hygienists working in oncology.
Yeah.
So guys, this is a real position.
Yes.
And many oncology treatment centers need you, but they don't really understand how bad. And so through our capstone project, if you take our certificate program, you're going to get a chance to go out and show them what you can do and get your foot in the door. We expect a lot of positions to be created because of this program.
And you'll find too, and I shared this in one of the modules, I've got my sister's a nurse, I've got a friend that's a nurse practitioner. And even when we talk to each other and you just, and I'm sure you can relate too, with other health providers, we all have our own language and understanding of things. And you start to realize what a large gap that there is. And so when you're on an oncology team, there's the PT, there's the OT, there's the nutritionist. And that's what I thought too, when going through my personal experience with Carolyn. Where is the dental hygienist on this team? Why aren't we there?
Exactly. You're 100% right. And that's why we've done this. It's time. The network's number one goal, our vision, our mission statement is that every collaborative care team in the nation employs at least one registered dental hygienist by the year 2025. It is a big, hairy, audacious goal, and we're going to roll up our sleeves and keep going, just like Megan and I have. We're going to be there working for you at 11 p.m. at night to bring you the latest research and standards of care and best practices and language and technology and products so that you just have a one-stop shop. And we also look forward in the future to be able to be the place that healthcare systems use to outsource their education. So as healthcare systems go, yeah, why don't we have, if you're an administrator, right, why don't we have one registered dental hygienist on staff to educate our medical providers, to be the oral health educator of our patients, to help us set up systems and processes? We will be your outsource for that education. So Megan, thank you so much for sharing your personal story. I thought it was really important for people to understand a little bit more about why we chose oncology as our first specialty certificate, and then of course why you were willing to be such a large portion, because you teach as well.
Yes, I teach and a lot of the modules as well too. So we'll get a lot of time to hang out together.
And just so you all know, Megan and I are the type of hygienists who, as soon as we reach one goal, we're already eyeing the next one. So we're also right now kind of sketching out what a pilot program would look like, utilizing a hygienist within an oncology setting to prevent and treat and follow up on all of the oral manifestations, specifically, hopefully utilizing a PBM laser. We really, based on the research that we've read, think that that is a missing link, a missing piece of technology that is really affordable for a system, because you buy it once and you can use it for years, and really would increase a patient's quality of life and patient safety as well. I mean, it is possible through oral mucositis to actually end up with a patient dying. So, yes, many things have to happen, and of course, they have to be immune compromised. But at the same time, what we found out was that if a patient has to stop treatment because the oral mucositis is so bad, that then the treatment doesn't work as well. When they go back to it, they're not going to get the same results. So it might be kind of low priority, low hanging fruit right now, but we don't believe that it is. We believe it got put there because nobody knew what to do with it.
And I think you'll find too, when you listen to Sarah Jane, she's going to be doing our photobiomodulation module. After listening to her for an hour, I mean, it was just like mind blowing.
Mind blowing. I've watched it twice.
This is our ticket as to getting a hygienist in the door in oncology, and it's going to make such a difference in the lives of so many patients.
Yeah, I agree. Well, Megan, thank you so much for sitting with me today, sharing your personal story, sharing a little bit about your journey and why this is a passionate topic for you. And if you guys have any questions, I'll leave the link to the oncology certificate program below, and also my email address, just in case you want to connect. We are looking for funding partners for that pilot program.